Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and I want to clear up a little confusion about facelift drains, and I might be a little part of the confusion. So I want to start at square one, all right? When you have a facelift or many types of surgeries, you can have blood or serum or various liquids pool and stay under the skin. And this can be a seroma or a hematoma. So generally you don't want fluids in a post-surgical space. So doctors use drains to allow that fluid to escape. There are passive drains, which are just gravity. There are active drains, which have a little vacuum source. There are vacuum drains, which cover wounds, a lot of different kind of drains, okay? But for facelift surgery, generally people use what's called a Jackson-Pratt type of a drain, and it has a little bulb that you squeeze and plug, and there's a little tube that comes out of the facelift site, and it drains off this fluid, and people leave them in place anywhere from a day to over a week. So to get back to the situation, there are some people that always use drains, some people never use drains. So my personal experience, I'm right around 1,400 facelifts. So for about the first 800, I never used any drains really, and patients did fine. I can't say I never got a seroma or never got a hematoma, but that's going to happen to everybody regardless of drains. And so some of my friends that I really admire, they said, no, you ought to try them. I think, my patients do better. They bruise less and everything. So I said, okay, well, I will start using some drains. And I did about 100 facelifts with drains. And I probably made some videos during that time, talking about drains or even maybe about the advantages of them. But I've quit using them. I really don't think that I saw much difference at all. The only time I'll use a drain now is if somebody has excessive bleeding during surgery. When I say excessive, I'm not talking about life-threatening, but some people just ooze more than others during surgery. And, facelift is a couple-hour operation. So if somebody's oozing a lot or more than normal, then I'll put a drain in. And I usually leave it in for 1 day, maybe 2 days. But I think out of I did 109 facelifts last year, I want to say we used 3 drains. So I don't do it much because I don't see much difference, okay? So what's kind of the bottom line here? Well, the bottom line is listen to your doctor, okay? Some doctors trained and they always use drains and they have good results with that, and that's fine. Other doctors never use them, and other doctors like myself will use them when there's an indication. Generally, across the board, patients don't like drains. You've got a tube coming out of your facelift site, and but sometimes you need it. So I just wanted to clear up any clarification, because I've had some viewers say, well, I saw one video and you didn't use drains, and then another video you talked about using them. So my personal situation, once again, I don't routinely use drains. I use them on a very small amount of my facelift patients, and I'm usually doing about 3 facelifts a week and over 100 a year. And so it's a pretty rare situation where we're using them, but if I think we need one, we will use a drain. I can tell you this, there's no evidence that says you're going to have a better result or quicker healing or less bruising or less hematoma or no complications if you use a drain or if you don't use a drain. And it's one of these things that, you just have to do what works well for you in your hands, and every doctor is different there. So hope I cleared this up and didn't even make it more confusing. I'm Dr. Joe Niamtu, LoveThatFace.com.
Practice. So when we're looking at facelift pictures, we want to look at the lower face and the neck, because that's where everything happens, and that's where you can tell the biggest difference. And this patient obviously had tremendous skin excess, and a very nice case, very happy patient. And we actually went back and lasered this a little bit, and it looks even better now. But even at this point, the patient was thrilled to get rid of that. Another patient, again, as the SMAS becomes droopy and the skin becomes droopy, and with birthdays piled on heredity, we just get this lower facial aging changes. Here's a patient before. I take my after pictures 3 months later, and as you can see, these are very controlled photographs, and I'm not manipulating lighting, background, anything like that. Again, same patient from a side view. And I tell you, as a surgeon, when I look at these, it just really makes me feel so good. You can see the patient has very natural earlobes after surgery and pretty much hidden incision line. You can barely see where I made my triarcu incision. And here's a patient before. That's after. That's before incision. That's after incision. I pay extreme attention to my incisions. And I do all this work under the skin, but the only thing that the patient and their friends are going to see, and their hairdresser and everybody else, are these incisions. So it's my signature. So here's a patient with a lot of obvious sun damage, and she has deep wrinkles and pigmented skin, and of course loose jowls and neck skin. And I treated her with my modified deep plane smastectomy, and also a comprehensive face and neck lift, followed by a laser, and the before and after is substantial. That's the same patient. Again, when I look at this, it really makes me happy that I have the skill set to make people look and feel better. And here's another patient. This patient doesn't have a lot of excess aging, but certainly what she has bothers her. And sometimes these little simple before and afters they are just as powerful as the big ones, because somebody comes in and they don't like their jowls and their neck skin, and you make them look better and you make a happy patient. Another view. Same patient. So, if you can see, we did her upper eyelids, lower eyelids, and comprehensive face and neck lift with my modified deep plane smastectomy. Another patient, again, skin excess. We did her eyelids as well as her facelift. And people really hate that skin under their neck, and they really love it when they can get rid of it. Here's a patient. Again, not a really old patient, not a ton of aging. The patient had a very hypoplastic profile, and we did a chin implant with a facelift with my modified deep plane smastectomy. And you can see what a great difference that made. I mean, some of these changes are literally life-changing for the patient. They're very fixated on their appearance, and possibly have been teased over the years for, in a case like this, not having much chin projection, and it really boosts their self-confidence and self-esteem. So thank you so much for your time. I hope you enjoyed this small sampling of my facelift cases. I have over 10,000 pictures at lovethatface.com. I love what I do, and thank you so much for your valuable time. I'm Dr. Joe Niamtu, lovethatface.com.